everyone, I'm Anna. This is my patient Sam. She's going to be the example today as we do the general survey and the comprehensive head and neck exam. So for starting with the general survey, that is just going to be looking at our patient and seeing their general appearance and whether or not they appear overall healthy or not. Hygiene is going to be important. Do they look disheveled or like they're experiencing any neglect or abuse? So all of those things, we can see that Sam does appear healthy overall and does not have any signs or symptoms of poor hygiene. Some patients will be looking for like holes in clothes or things like that, and she has none of those things. So we will move on to begin with the head. We always start with inspection, and we also always look for symmetry first. So I'm going to stand up here for a second. We're going to inspect the head and scalp. I'm also going to palpate. I'll start with inspection as I'm looking at the scalp, looking and seeing if there's any redness, dry flakiness, any abrasions, anything like that. Also examining the hair, seeing if there's any like broken hairs or any discoloration there. Sam, have you noticed any itchy scalp flakiness or anything along those lines?
No.
Perfect. So now I'm going to palpate. I'm going to place my hands on your head. We're just palpating the head for any tenderness. You can palpate the occipital bone back here as well. Tenderness, swelling, pain, anything like that. If we were doing a full skin assessment for this video, we would do the whole body. We would look at the hair distribution across the body, make sure that was normal. We'd also look at skin color. You can generally see that here, that it is normal with her ethnicity. We'd also be looking at freckles, any type of lesions, making sure there's no change in color. We palpate to make sure there's no elevation. Ask the patient if there was any changes with that as well. For the sake of time, we're not going to go into full body for that, but that is what we would do. So now from the head, we will move on to the eyes. I'm going to sit back down. We would first again start with inspection, making sure that eyes are symmetrical, and they are. We're also looking at the eyelids, eyelashes, eyebrows, making sure everything's intact there, no redness. Looking at the sclera, making sure it is not red or yellow tinted, and we see that it is white. Also I'm going to put my thumbs on her eyes. I'm going to pull down. We're going to examine the conjunctivi and just make sure that it is pink, not overly red. And I'm going to move and palpate the lacrimal ducts. We see there. We're also inspecting and feeling just for any blockages. We can ask the patient, do you have any overly watery watery eyes or itchiness? Have you noticed any of that?
No.
Okay. Any blurry vision changes?
No.
Perfect. So I'll now just continue to palpate the occipital bone here, and we can also percuss the frontal and maxillary sinuses. We're doing that. What we're assessing for there is any pain or tenderness. We'll then move to the temporal artery, where we should palpate equal, strong pulses there. We're going to move down to the temporal mandibular joint, which is just right in front of the ear here. I'm going to have you open your mouth really wide. Perfect. And close. You should not feel any clicking when that occurs. Have you ever noticed any pain or anything with chewing or talking a lot or anything along those lines? Yeah. Perfect. So now I'm going to just be assessing your visual fields. And so the first thing I'm going to have you do is just look straight ahead. I'm going to have you look at my finger. I'm going to have you follow my finger. We're testing your extraocular muscles, so just want your eyes to move and not your head. So we're going to move this way, up, down, back over, up, and down. Perfect. We'll come back to the middle here. We're going to test for, let you rest, test for accommodation. I'm going to move my finger closer to your face and just watch your pupils converge in, and they do good. The next thing we're going to test is visual fields through confrontation. So what I'm going to have you do is cover, we'll go ahead and cover your right eye first. I'm going to wiggle my finger, and what I want you to say is just say now when you see it in your visual field. Okay.
No. No. No.
Okay.
No. No. No.
Perfect. Just here we're making sure you can change, we'll cover your other eye, we're just making sure we're about arm's length apart so our visual fields are the same and I can test the normality of it.
No. 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 No.
Perfect. Alrighty, now we are going to take a look at your pupils. So I'm just going to test them for their equalness and their reactivity to light. And so I'm going to have you we'll cover your right eye first. I'm going to shine this light in your eye. We're going to make sure it constricts. Perfect. And to the other one. Perfect. And then uncover both. And I'm going to shine the light in this eye again. We just want to make sure that they both constrict bilaterally as well. Good. And they do. Great. Now we're going to take the ophthalmoscope and we are going to examine the different parts of the eye. The main thing we do with this is the red eye test. And so what we want to see is the optic lens just turn kind of that orangish reddish color. So with the right eye and my right eye, I'm going to make sure this light is on again. Just have you look straight ahead, Sam. And I'm going to get a little bit closer. And we just want to visualize the optic disc. That color is that reddish orange color. We're looking at the veins and arteries as well, and the macula, if we can visualize that too. There we're checking for any opacities in that lens or anything like that. So we'll do the left eye again, my left eye, her left eye, and that eye is normal as well. Good. All right. I'm gonna take this off. We're going to be going now to your ears. So again, we are just assessing. Oh, I'm out of video. Assessing externally. We can see that there is no redness, drainage, swelling, anything like that. Have you noticed any difficulty hearing or any pain in either ear? No. Okay, good. So we'll start with the inspection with the otoscope of the inner ear now. For this, we want to pull back the top of the ear to kind of extend the auditory canal. Put it back here. All right, we're visualizing the tympanic membrane, that it should be that pinky gray color. Also, we're going to pull back a little bit more. Also assessing for any overt redness, swelling. We're looking at the light reflex and just making sure that tympanic membrane is not swollen, tender, that there's no excessive buildup of earwax either. And both ears appear to be normal. Do you have any pain or tenderness when I do that?
No.
Good. All right. Now we're going to do a few hearing tests. And so the first one we'll do will be a whisper test. So I'm going to kind of get behind you over here, if I can. I'm going to whisper 3 things and then have you repeat them to me. We'll do this twice.
3, 2, 1.
Good.
Cat, dog, son.
Perfect. Alrighty. Next, we'll test for air conduction and bone conduction. And so what I'm going to have you do is tell me which one of these is louder. You can say the first or the second. going to do the bilateral bone conduction with the Weber test. So I'm going to sit this on the top of your head, look like a Teletubby, and just tell me which one, if you hear a sound louder in one ear or the other, or if it's equal in both.
Equal.
Good. And it should be equal in both. So we are all good there. All right. Next, we will move to inspecting the nose. Again, assessing for symmetry. Sometimes the nose can be a likely place for trauma, so we're looking, seeing if there's any asymmetry there. We're going to just take a look inside the nares. We're looking at the turbinates, we're looking at the mucosa, and we're looking at the septum, making sure there's no deviated or perforated septum. You do that with the otoscope, and we'll just take a look there, make sure there's no blockages either. So I'm going to have you tilt your head back. You can kind of look without the otoscope and get a general idea, but we will go ahead and shine the light up there. Perfect. And we see no redness. If we needed to really look for the perforation, we could get the light a little bit further up in there, but we won't do that right now. Have you ever been told you had a deviated septum, perforated septum, anything like that? No? Okay, perfect. I'm gonna switch my tips here. We will now move to the mouth. I'm gonna have you smile. Perfect. We got a symmetrical smile. Then I'm gonna have you open up real wide for me. Stick your tongue out. Good. And then now we're just inspecting the mucosa, making sure everything is pink, red, moist, intact. We also examine the pharynx, making sure there's no swelling in the throat, no whiteness, no plaque, and just no swelling of the tonsils either. I'm going to have you stick your tongue all the way out and say ah, and we'll try to initiate a gag reflex. All right, perfect. So we test the gag that it is intact. And from the mouth, we will move on to the neck. And so, again, initially we are inspecting the neck. We are looking for symmetry. We're also looking to see if we can visibly see the thyroid without palpation. It's not common in everyone. And so I cannot visibly see the thyroid in Sam. First, before we start with palpation, I'm going to have you show us your range of motion. So we'll start with flexion. If you can bring your chin down to your chest, and then all the way back for extension, and then side to side for lateral motion. Perfect. And this part is a little bit uncomfortable for patients, so I'm just going to gently palpate the trachea and sternal notch. And here we're just assessing for any pain or tenderness, swelling, any of the abnormalities here. We have the tracheal notch here. Good. And the other thing we want to palpate for specifically in the neck area is the lymph nodes. And so with that, I'm going to start with my hands behind your head. And we're going to palpate the occipital lymph nodes, the post-auricular lymph nodes, the pre-auricular lymph nodes, the submandibular lymph nodes, the submental lymph nodes, the superficial cervical, the posterior cervical, and the deep cervical chain. And then we'll then palpate the subclavicular lymph nodes as well. And so with that, you're just assessing for any swelling, pain, any enlarged lymph nodes is going to be the main thing we're looking for there. Now we will move to palpate the thyroid gland. That'll be the last thing we do. So I'm going to come behind you. It's going to be a little bit uncomfortable again. We're going to find that trachea there. And then I'm just going to have you swallow for me. Good. You should feel the thyroid gland just kind of roll under your fingers there, and it should not be enlarged. So that concludes our head and neck exam. Thank you so much.